In this video today, I am going to discuss regarding a new medical topic, that is uterine fibroids. What is uterine fibroids? Symptoms, tests to rule out uterine fibroid, when to consult your doctor, the causes for uterine fibroid, complication of uterine fibroid, the treatment aspect. Here I will be discussing ayurvedic treatment, allopathic treatment, medical procedures done for uterine fibroid, surgical procedures, doctors to consult in uterine fibroids. Everything regarding uterine fibroid will be discussed in this video. So stay tuned. Hello friends, you are watching YouTube channel Venkatesh H. Pujar and it's me Dr. Venkatesh H. Pujar. So let's start the discussion. Uterine fibroids are non-cancerous growth of the uterus that often appear during childbearing years. Uterine fibroids aren't associated with increased risk of uterine cancer and almost never develop into cancer. Fibroid range in size from seedling undetectable by human eye to bulky masses that can distort and enlarge the uterus. You can have single fibroid or multiple ones. Many women have uterine fibroids sometimes during their lives, but you might not know you have uterine fibroids because they often cause no symptoms. Now we will be discussing here regarding the symptoms what a female or a woman can have during uterine fibroids. First is heavy menstrual bleeding, prolonged periods and pelvic pain, abdomen pain, lower back pain, pelvic pain, abnormal menstruation, heavy menstruation, irregular menstruation, painful menstruation, frequent urination, difficulty in emptying the bladder, constipation, backache and leg pains. Now we will be discussing regarding tests to rule out uterine fibroids. First is pelvis examination by your doctor. Second is ultrasound USG of abdomen and pelvis, gives you the clear picture. Now I will be discussing here when you have to consult your doctor. First is if pelvic pain doesn't go away, overly heavy, prolonged and painful periods, spotting or bleeding between periods, difficulty in emptying your bladder, unexplained low red blood cells, that is anemia. In these conditions you have to consult your doctor as soon as possible. Now I will be discussing here regarding the causes for uterine fibroids. First is starting your period at an early age. Second, obesity. Third is vitamin D deficiency. Fourth, diet higher in red meat. Red meat means eating the meat of pork, horse, beef, mutton, goat, and lower in green vegetable, fruit and dairy products, drinking too much alcohol. Next is hereditary. If your mother and sister had fibroid, you are at the risk of developing them. Now we will be discussing regarding here the complications of uterine fibroids. Fibroids usually aren't dangerous. They can cause discomfort which can lead to complications such as drop in RBC, that is anemia, which cause fatigue, heavy blood loss. Rarely a transfusion is needed due to blood loss. Now I am going to discuss regarding the ayurvedic treatment for uterine fibroids. For generally uterine fibroid cases, we give medicines like tablet amtutone, syrup amtutone, Chandra Prabhavati, Kanchanara Guglu, Kanaka Sattwadi Kashaya, Ashwagandha tablets, Dashamula Rista, Pravala Panchamrita Rasa, Pravala Pisti, syrup Ashnol, and we recommend yogas and asanas for females to increase the blood flow of uterine fibroids so that the size of uterine fibroids can reduce. So some of the asanas we recommend are Baddha Koda Asana, Paschimotthasana, Salabhasana, Dhanurasana, and pranayama like Kapalbhati is advised, but Kapalbhati is contraindicated. Females with large fibroids and heavy bleeding, it is not recommended. Now I am going to discuss here regarding the treatment aspect of allopathic medicine. What is the treatment of allopathic here? Medications in allopathic used are birth control medication, hormone and sex suppression medications. Now I will be discussing regarding the medical procedures done for uterine fibroid cases. First is endometrial ablation. What is endometrial ablation? Minimum invasive surgical procedures done to destroy the tissues in the lining of uterus, which is called as endometrium ablation. Second medical procedure done is uterine artery embolization. What is uterine artery embolization? Procedures done to develop clot in the arteries. Once blood supply gone, the fibroids will shrink. Now I will be discussing regarding the surgical procedures done for uterine fibroid cases. Surgical procedure first recommended is hysterectomy. What is hysterectomy? The surgical removal of the uterus is called as hysterectomy. Second, laparoscopic surgery is advised. Third, myomectomy is advised. Myomectomy in that surgical procedure to remove the uterine fibroids only. Now I will be discussing here doctors to consult in uterine fibroid condition. First, you have to consult your family doctor. Second, you can consult a gynecologist doctor in allopathic medicine. You can consult a ayurvedic gynecologist. They are known as Sri Prasudi Visheshagya. You can consult any homeopathic doctors. All the branches are having its own pros and cons. Finally, it is a patient call whom to consult. I hope this video was helpful for you. If you still have any doubts, then comment in the comment section. I will try to answer all your queries. If you want to see the same kind of medical content in future, then don't forget to subscribe to the channel. Do like and share this video as much as possible. We will meet you in another video with some new and good content. Till then, take care. Thank you.